When we talk about senior living, most of the time we're talking about out of the home. There's a process called aging in place that people would like to stay in the place that they're at, but there's a safety factor to some of that. So one of the very first things I want to kind of forewarn you about that's industry-wide is the internet lies. You cannot get on the internet and find out about senior living and have any hope that the accuracy is going to be there. I found a website that said there's this fantastic place in Leesburg. It's $780 a month with everything provided. And you click through and it was one of those, you have to call us. No such thing actually exists. So the first thing I want to make sure you know is work with someone local that actually knows, not someone in New York City that owns a bunch of websites that collect your data and sell it to big companies. So why in the world would you live out of your home? Several reasons for seniors that advance in age where aging in place becomes an issue. We know that as our bodies begin to fall apart, that we tend to do fewer things and we tend to move less. So socialization is a key part of keeping your immune system healthy. So if you're not being able to get out and socialize, that's alarm bell number one. Two is it still safe? Because the way that your house is designed is for people that can move. In the old TV shows, they always had the bedrooms upstairs, and they never showed Grandma slowly getting up, but the ad would come on and there's a nice chair for Grandma to ride up and down. So out of the home happens when the body or the mind says it's no longer safe for you to be in the home that you prefer. There are actually 8 levels of senior living based upon licensing that most people don't know. The industry has sort of made it simple of all of these communities, facilities, whatever the word you might want, actually are all the same, but they're tremendously different. A person can take care of up to 2 people in their home with no license, no inspection by the state, no requirement that they know anything, and can charge whatever they want. We call those unlicensed homes, and the state will not do anything about it as long as there's only 2. So if you happen to put your loved one with someone that knows what they're doing and can handle it, but there is absolutely no third party coming in to make sure that that continues or that things aren't happening. So we don't think that using an unlicensed care home makes any sense for your loved one. So the industry came up with a version of that called independent living. So in independent living, also, there's no license, there's no care, and they're able to do it legally by saying, we don't provide care. So we have a big building, we still provide housekeeping, we still provide meals, we still provide transportation, we still provide a space, but there's no care, therefore we're not licensed and there's nobody from the state coming in to make sure that you are being appropriately cared for. And that's called independent living. Adult family care homes are small houses that the family lives there and they can take in to up to 6 people and provide care. They are licensed by the state, they're inspected by the state, and because they live there 24/7, there are things that they can do clinically that other assisted livings can't do. Now, assisted living, a basic assisted living facility can be as small as a house that takes 5 people to as large as a tall, multiple-story building that can take 2,000. So assisted living in Florida, from a basic license standpoint, is not dependent upon size. The basic license has to do with the amount of clinical things that they can handle for your loved ones. There's a license called limited mental health. That means that they have the ability to handle residents who have mental disease, and therefore their license means that the their employees are trained, and that they have a healthcare professional that knows how to deal with those individuals whose mental health makes them difficult to place elsewhere. There's a level called limited nursing, and a limited nursing license means every day there is a nurse on the premises, LPN or an RN, but the issue is that no day goes by that there's not a nurse on the premises. So from a limited nursing standpoint, depending on your clinical needs, that's one of those things that you should take into consideration if that's what your needs are. Harbor Chase is one of the ones called extended congregate care. And extended congregate care means there's a nurse on the premises 24/7. So you can tell there's a huge difference as we go from a non-licensed that anybody can do to an extended congregate care where there's always a nurse on the premises, not on call, that can come check on whatever it is that you need. So if your body is starting to decay, or your mind is starting to decay, and your needs will likely increase, you want to make sure that you pick your senior living choice, not for today, but for the length of time that you want to be there. In the case of dementia and Alzheimer's, change is very, very difficult. So you want to make sure that you find a place where when they make the adjustment to being there, there's not another big change in their life that they have to get used to. So for the length of time that they're going to be in a memory care unit, ideally it would be the same one. And then there's another level called nursing homes. We call it skilled nursing. That means that every patient has a nurse that's responsible for their care. They still have the nursing associates that do the hard work, but unlike ECC, that they're on premise, every patient has a nurse that's responsible for them. And so skilled nursing homes, or what most people incorrectly refer to as rehabs, have all of that. The business side of nursing homes in Florida is that the majority of the long-term care people that live there are on Medicaid, and Medicaid pays about 44 cents on the dollar to what Medicare will pay for rehab. So most nursing homes, if you'll look at their signs, they always say nursing home and rehab, and some of them only do rehabs. Don't know any of them that only do nursing homes yet. We think that's coming, but what's called swing beds, so they try and stay as full as they can with the rehab people coming through every 20 or 100 days, not the long-term care nursing home people that they're accepting 44 cents on the dollar from Medicaid. So that's the aspect of when you reach a point, the state in their licensing allows certain things that assisted livings can do. So we'll use Harbor Chase as an example. They have the highest license possible for an assisted living in Florida. They may not have someone live here who is bedbound more than 14 days. They may not have someone who has a tracheotomy. They may not have someone that two people can't get up. So if they're not able to, it's called assisted because you can get assistance, but there's a limit to how much that is. So there are certain conditions. We had a client a few years ago that had Parkinsonism. Parkinsonism is where you have zero control of your body, and you're always moving because of the Parkinson's. It's not Parkinson's disease, but so we had to put him in a skilled nursing unit, private pay, which is really expensive because they weren't able to put him into assisted because of the condition. Appropriateness of placement is huge. We're finding more and more where people are choosing an inappropriate place, which means the marketing people in the facility said they could handle it when they couldn't, and then as things change, they're having to leave or be kicked out, or we had one poor guy said they wouldn't accept his long-term care insurance. Turns out they didn't have the right license to accept his long-term care insurance, and he was quite surprised when we ran across that he could move to the appropriately licensed assisted living and have his long-term care policy pay for his total cost of care instead of paying out of pocket, which was never explained to him by the nice people that took him in where we found him. And I think one of the things that becomes important is understanding the effect financially on senior living. Chinworth, who puts out estimates of what it costs, put out one this week that said in the villages you can expect to pay $5,000 a month for an assisted living. You can expect to pay $8,500 for a nursing home. You can expect to pay $4,000 a month for 20 hours of home care, where you also pay the mortgage, the care costs, the food. So in-home care becomes the most expensive way to get that care, even though it's highly desirable for those aging in place folks. And for most people, saying, hey, I'm going to put out 60 grand to provide all of my care costs is more than they necessarily had saved up. The average age of a person in assisted living today is 84. We believe somewhere between 75 and 85 things happen to the body where that's kind of the age group that normally we start talking about a senior living out of the home scenario. So where do you find that money? Well, the VA aid and attendance is a huge part. A veteran can get up to $1,830 per month to help pay for that. Medicaid has something called a Medicaid waiver that will pay somewhere in the vicinity of $1,000 depending on which of the insurance companies. So if it's $5,000 and Medicaid will pay $1,000, by simple math that means there's $4,000 left, and you can't get on Medicaid if you make more than $2,000. So you've sort of figured out why there's a gap in what the state is going to be involved with for those individuals. There are places outside the villages that are not that price, but for most people that live in the villages, after seeing the cruise ship on land that you'll get to experience here, it's a big change to find those homes that will actually meet their needs for the money that they have. I mentioned aging in place at the beginning, and aging in place is by all estimates, 80 to 90% of the people buy a home, they want to live there. And Kevin's going to talk to us about real estate in a minute, and so when they make those purchases, they're thinking, I'm going to be here forever. They don't count on the things that happen financially, investment-wise, what happens to their body, their family, nice big house, the two people rattle around, one passes away, the other one left is lonely. There's the, what happens to my body, I can't do what I used to do. There's the, okay, I've lived in this house for 28 years and absolutely everything now needs to be replaced. And so the cost and hassle of just maintaining. So the aging in place piece, I think Katina said it best, has to be part of what is your life plan. If your life plan is your children are going to step in and help in those areas, so that's part of, and many times in the villages, that's what they're looking for. They live up north. When mom and dad passes away, that house in the villages is going to them. They're 5 years away from being able to retire to the villages, and it's a generational thing now that the villages have been here long enough that they're making that next move down. But senior living out of the home needs to be with a local expert that can get you into the right one to begin with for you, and then not be part of what will bankrupt you, trying to keep up with everything else that is part of your life. It should be part of a larger plan. 7% of the people have long-term care insurance that helps pay for these things. 77% of the people will need long-term care. So you can tell there's this huge gap of people that it's going to be a financial decision of how to provide care. Dementia and Alzheimer's is the piece that there's no good answer for. The caregiver that takes care of the person with dementia has the most stressful job in the world, no matter how you measure stressful jobs, to the point that 63% of them actually pass away from the stress before the loved one they had with dementia. So that is one of those situations where they want to take care of them, and nurses and doctors are the worst about this. I can handle it, but in reality, if someone in your family has dementia, you need help. There has to be a change in your lifestyle to relieve that stress. It will physically kill you. And so some of these situations aren't choice, they're need-based. And when the need arrives, Angela had one that he took his wife home, said he could handle it. 2 days later he called and said, okay, she hasn't slept, neither have I, help, I'm going down. Had to get handled that hour, or he was in big trouble. Pre-planning is so much better than the emergency room, which we meet a lot of people in the emergency room. It's the caregiver that shows up in the emergency room, and the nice dementia person rode along in the ambulance, and the hospital doesn't know what to do with them. There's not a Medicare payment to take care of people with dementia, so the hospital is just going, can you please do something with this person who, through no fault of their own, has no idea necessarily what's going on. So that's all I want to talk about with senior living, but it's key point, don't believe what you hear on the internet. Talk to somebody that actually knows what they're talking about.